Welcome to Let's Talk with NP Student, where we're keeping you updated with every aspect of your life in and out of school. I'm your host, Dr. Patrice Little, and I'm so excited about our Men's Health Awareness series. We are continuing this conversation, and today just happens to be International Men's Day. And joining us is Dr. Julian Gallegos, and he is a board certified family nurse practitioner as well as a certified men's health educator. And so we are so delighted to have you, Dr. Gallegos, to join us uh, with this conversation with International Men's Health Day. How are you?
Good. Thank you for having me.
Well, let's get right into it. So, the first thing, of course, that many individuals would like to know, including myself, is about your background work as a family nurse practitioner and your role as a certified men's health educator.
So thank you, Dr. Little. So as a certified men's health educator and nurse practitioner, my role is actually fairly multifaceted and deeply committed to improving men's health outcomes. A significant part of my work actually involves education and awareness. This means providing up-to-date and accurate information about men's health issues ranging from specific concerns like prostate health, testicular cancer, hypogonadism, to broader areas such as mental health, nutrition, and even exercise. Another key aspect of my role is promoting healthy lifestyles. I actively encourage and guide men to make healthier lifestyle choices. This often involves designing and implementing programs or workshops focused on diet, exercise, stress management, and the avoidance of risky behaviors in men. This is inclusive of their female partners if they have a female partner and or male partner, depending on the dynamic of their life. Counseling and support also is a crucial part of my work as well. I offer individual counseling typically as a nurse practitioner in my role on variety health concerns, including sexual health, mental health, and management of chronic diseases. Another thing that I'm involved with is community engagement and advocacy, which is an integral part of my actual role. I work towards raising awareness about men's health issues within the community. Um, for instance, being on this broadcast is one. This can involve also organizing health fairs, speaking at public events, professional conferences, those sort of things. Um, I also try to stay informed about the latest research and developments in men's health, which is essential and crucial to the work that I actually do. I'm actually starting to become more actively engaged in research and obviously continuous learning on topics related to men's health. Um, One of the big things for me is collaboration with healthcare providers, which is also very important. I work closely with physicians, nurses, and other healthcare professionals to ensure a comprehensive approach to men's health actually occurs in the spaces that I work in. I truly believe that this interdisciplinary collaboration is vital for overall holistic health outcomes for men. So, just a little bit, in addition to my direct role, I'm also aligned with missions organizations such as the American Association for Men in Nursing
Okay.
and Healthy Men's Inc. We know that AMN focuses on basically shaping the practice, education, and research and leadership for men in nursing, but it also aims in advancing men's health. Meanwhile, Healthy Inc. dedicates itself to reversing negative health outcomes through education advocacy, specifically in men and boys.
And one of the things that stood out when I went to look up the Men's Health Inc. is that they offer that certification, the Men's Health, the certification in Men's Health, which was something that I did not know. So that means that you all are bringing awareness about men's health every day and not necessarily during the designated month of June and November.
Correct, correct. Healthy Men's Inc. has made a concerted effort to develop this certification to allow all providers, not only advanced practice nurses, but nurses and social workers, anyone who is involved in men's health, to become certified as certified men's health educators.
And when did that certification come about? Like when did it first start?
The certification actually began approximately 2 years ago through Healthy Men's Inc. It's been around. I think they initially were funded by a grant. I now serve as an advisory on the advisory board. I most recently got involved with them probably within the last 9 months. So I don't know exactly when it, but based off of what the conversations I've had and obviously the website, it has occurred. This was developed within the last 2 years or so.
Okay. One of the things that you had mentioned earlier when you were giving your introduction is that approaching men's health from a comprehensive perspective. And what I've as an MP, I've always looked at men's health until I had worked in men's health and the corrections as, oh, it's about, hey, they're having the male pattern like baldness, and they may need some it has something to do with their testosterone or them having erectile dysfunction, but there's so much more to men's health when it comes to that. Can you talk a little bit on the comprehensive side?
Yeah, so a lot of people think of men's health related primarily to sexual health rather than the comprehensive men's health component. When I speak to comprehensive men's health, I'm talking to more about the overall person, from mental health to physical health, which also incorporates chronic disease management and obviously prevention. That's kind of the key, right? We want these
Correct.
guys to come in when they're supposed to, at least annually, to get that preventative care, so that way we can counsel them on anything that they may be off a little on, whether it be their lifestyle, such as their eating or their exercise, or even, just overall their sleep. That's a big one in men's health. So, as a comprehensive men's health NP, I do focus on a lot of things that you would commonly see in family practice, but it's all focused on men rather than the overall family. I do talk to my men about uh, their fathering, how they father their children. A lot of times we get into conversations about that, especially as we talk about issues with mental health. And there's a lot of topics that I cover that are not traditionally seen in what you would consider just men's health.
And with that being said, when you with as far as topics not commonly seen with when we talk about men's health, one in particular is the cultural and ethnical background and how it influences men's health, which is what brings us here today. Can you tell us a little bit? We'll focus on one group for tonight's show because we know we could always run them over to another show in the future. Can you share some insights into how the cultural perception of masculinity, particularly within the Hispanic community, how it can influence men's health, their decision and attitudes towards pursuing healthcare?
Yeah, certainly. So this is a critical area of focus in men's health education and clinical practice, especially considering the unique cultural dynamics within the Hispanic community. So the concept of masculinity, or even it's called machismo in Spanish, as it often is referred to in primarily Mexican American culture, but it kind of permeates through overall all the Hispanic groups. It plays a pivotal role in shaping how men perceive their health and approach healthcare. Um, Machismo is not just a social construct. It deeply influences men's awareness of their own health. Um, it instills in them the belief that they need to be robust and healthy to effectively fulfill their roles as fathers, husbands, brothers, sons, you name it, workers, community members. This perspective can be both a strength and a challenge. On one hand, it can motivate men to make proactive steps in maintaining their health, so you can take advantage of that as a practitioner. But particularly when they experience pain or disability, as this is very concerning because as oftentimes these are seen as impediments to fulfilling their overall roles, and often leads them to not seeking care. However, on the flip side, the same notion of machismo can sometimes lead to the reluctance to seek help or acknowledge health issues, particularly those related to mental health or preventative care. There's often a perceived need to maintain a facade of strength and resilience, even at the cost of personal health. Um, so, as practitioners, it's crucial to understand these perceptions. It's important for us as clinicians, especially those of us working closely with Hispanic community, to recognize how these cultural views on masculinity can influence healthcare decisions and overall approach to health. Um, by knowing this and this knowledge, it allows us to approach in a way that resonates with these men, helping them become more aware of their health status and encouraging them to seek healthcare when necessary.
So one of the things is you mentioned that how do I pronounce it again? Is machizos?
Machismo.
Machismo,
Like,
pardon me.
yeah, yeah,
So
that's it.
machismo for you said more that's a common term that may be used among Mexican and Mexican Americans. So is it safe for me to say that we should not assume as far as that blanket statement for all Spanish speaking males that we should really inquire during the medical interview as far as their cultural background. Is that correct?
Yes and no.
Okay.
Machismo is a social construct that oftentimes permeates outside of the Mexican culture. You see it
Okay.
also in the Colombian, Salvadorian,
Okay.
Argentinian. There's, just anecdotally from having worked with a lot of these men, but it's primarily when you look at the literature, it's primarily focused on the Mexican American or Mexican culture.
Okay.
But you see it very often across those. Latin American countries. I could even say that even with, I know we're talking about the Hispanic community, but even our African American brothers who
Mhm.
also have a sense of machismo, for lack of better terms, right?
They
Um,
do. They do. They do. Okay. Well, thank you for
mhm.
clarifying that for me. I wanted to make sure I capture that correctly, not just for my understanding, but for also for those tuning in. So you're right. As providers, it's important that we have that particular understanding. One of the things that I am aware of is that the spouses or the women, pardon me, I shouldn't just say spouses, but the women in the family also has an influence on the men actually pursuing healthcare visit. Can you talk a little bit along the lines of that?
Yeah, definitely. I think the spouse, whether it be female, male,
Female, male.
depending on the situation,
Mhm.
they do play a vital role in encouraging these men, specifically in the Hispanic community, for seeking healthcare. A lot of times, I get men who come into my practice, and I ask them, "Why are you here?" They say the first thing they say is because my wife told me I had to be. And so they do play a large role in that. I actually recently, with Healthy Men's Inc., wrote a few articles specifically to flu vaccination and um, how men can actually, or family can actually help encourage men to obtain these vaccinations that are needed. So I think oftentimes men's health, we think of just focusing on men, but we also need to focus on the spouses who are oftentimes drivers of of the health that the men are receiving.
I read that article, it was good. The
Yeah.
one on flu, I read it recently. So, another thing is that I want to go into is this has been on my mind for all day. I wanted to talk a little bit about food
Mhm.
because oftentimes there's an assumption that if you are from if you're Hispanic or if you're Carib or African American, that you eat a particular type of food where things are kind of really not like that anymore. It's almost like a culture within a culture. Can you talk a little along the lines of just like the different types of foods and practices that can impact the health the health of, Hispanic men.
Yeah, I think in the Hispanic community primarily, if you are working with individuals who have recently immigrated to the country or first generation immigrants, oftentimes what you see in the textbooks is actually true. That they consume foods that are primarily associated with their culture, such as rice and beans and tamales and all those wonderful um, unhealthy foods that we like to consume. So addressing those things in those generations is very important because oftentimes they are consuming those types of foods. But as you move away from the first, second generation, oftentimes these generations have assimilated to the local food culture. So
Right.
things like eating fast food is one of the big ones, just like anyone else, like most Americans in the United States who consume, foods associated with fast food restaurants. So I think getting a good understanding of what the diet is of the individual is important, especially during that health history. For instance, we've had cases where our students have gone in and actually, because I take students so I'm also an academic, and I take NP students into our practice. And oftentimes, when they're later on in the program, we kind of let them go in on their own to talk to the patient. I've had students who just didn't understand that oftentimes these Hispanic patients may not be eating bread. For instance, when they're addressing diabetes, they're eating tortillas or they're eating, something else. So, so when you tell the guy, don't eat bread, well, he's like, I'm good because I don't eat bread, but I eat, little do that we know that they eat like 7 or 8 tortillas in one sitting. So I think a very in depth, or at least a good health history specifically to diet is important, because you can't assume either. Oftentimes, I will find even new migrants to the country who think that fast food is considered, for lack of better terms, bougie. It's, now I can afford it, so that's what I eat. This a lot of times we assume that they're still eating staples that are associated with their home country, and they're not.
Mm. And I'm like that you mentioned that. That's a part of, like, it's our responsibility to inquire about what their diet is. I've always felt that way, just personally as someone I'm first generation American, so I'm one of those people that you described that still eats the food
Mhm.
that's native to my to the country. Um, I do eat foods, of course, that are common here, like American food, but my main diet is a Jamaican diet. And one of the things is when I've gone to for a visit and there's assumptions that I was eating particular foods when it came to weight, and that they're like, stop eating fried chicken. Well, we don't eat fried chicken.
Right.
So what happens is you're actually creating a barrier, because then you're taking back as a patient, and you're like, okay, this provider's just seeing me just like they see everyone else. They're
Right.
not really treating me as an individual, which sometimes could be feel like you're not really respected or regarded as a person. So that was where I was going with that. Can you maybe walk us through how we could ask patients or inquire? Because sometimes people say, I don't know how to, as far as the script, I don't know how to talk to my patient or how to start the conversation. It shouldn't be too complicated because we learned that in physical assessment. But can you walk us through how they would inquire about their diet, particularly for a patient who has diabetes, who we're trying to have a goal of having lifestyle modification?
Right. I think the easiest way to ask the patient is just come out and ask, but getting a dietary recall, a 24-hour dietary recall can give you a lot of information, even if you could go up even to 48 hours. But typically, once you get that initial 24-hour dietary recall, most patients, for the most part, consume the same types of foods day in and day out. We're creatures of habit. So, we know that people who eat very healthy oftentimes eat the same exact thing. Well, people who aren't healthy and eating the things they shouldn't be eating are eating the same exact things for the most part each and every day. So obtaining that 24-hour dietary recall is probably a first start, so that you can
Mhm.
have a basic understanding of more or less what the patient is eating. Sometimes patients will say, I didn't eat very much, or I didn't eat as I typically do. Okay, then tell me about a day of the week. Give me a day of the week that, give me the menu of what you eat during the week, because they might be working, and then tell me on a weekend when you're off, what are the foods that you eat, and maybe you can get
Mhm.
two separate occasions where maybe during the week they try to eat as healthy or don't eat as much because they are working, versus the weekend when they're having all these fiestas and parties, going to
Cheat
baptisms and
days.
weddings, yeah, and funerals and everything else.
Yeah.
So, so getting a better idea of two different points during the week.
I like that. I'm going to add that to my practice. I promise you, I've never asked them about the difference about how they eat on the weekends versus during the week, and you're absolutely right. Hmm.
Yeah, definitely. It's something that's important. One thing that I've been integrating into my practice, I know we've probably heard of AI and the use of AI. Actually, using AI to actually create diet plans for my patients based off of their likings or dislikes of foods. And then obviously I review it before I hand over to them, but it does a really good job at giving them a diet plan that kind of fits within a certain amount of calories. So I've integrated that into practice, and surprisingly enough, AI is actually pretty good at converting things into Spanish because obviously the Hispanic population, I work with a lot of Spanish speaking patients.
Okay.
So I have used it for my benefit.
Well, thank you. That I didn't even know about that part as far as creating the diet plan, so I'm gonna look into that as well. Is there anything else you wanted to add as far as like with the cultural practice and how we could, as providers, approach our Hispanic males better?
So I think we touched on that family dynamics plays a significant role in the Hispanic community. So understanding who the head of the family actually is. Oftentimes, it may be the mom who lives in the household and not the actual male spouse who lives with his family. So sometimes getting mom involved, mama, telling
You mean
specific
abuela?
abuela,
That's what
yeah, yeah,
that's what I
getting
call mine.
yeah, getting
Yeah,
abuela involved, because
yeah,
sometimes she can make that influence. The spouse of the male patient may not even have that influence. It may be his mom or his mother-in-law, depending on on the dynamics of the home. Also, religious and spiritual beliefs are another key aspect, specifically in the Hispanic community, that plays a huge influence on perceptions of health and illness. Some of these individuals, specifically those who are fairly new to the country or even second or third generation, oftentimes prefer traditional remedies or seeking spiritual guidance before making decisions. Um, Along with that, I think communication styles within the Hispanic community can sometimes lead towards indirectness, which that actually affects how health concerns are expressed and discussed with healthcare providers. I think we need to be aware that a lot of times these men, specifically in the Hispanic community, they often shy away from addressing certain aspects of their healthcare. They might be quick to answering questions about,
mm,
their food choices, but then when you get down to sexual health, they may completely shut down because
okay.
it's something that's taboo. But making them comfortable and with discussing anything with you is paramount. So the way you communicate with them is important. In my practice, not only with Hispanic men, but all men, I kind of treat them like my brother, and I try to um, provide a space that is safe for them, which can be somewhat daunting for some providers because some providers want to maintain that rudimentary professionalism. I maintain professionalism, but I also open myself up to be able to allow them to feel comfortable with me as their healthcare provider.
And what I found in practice anyhow is that they already have a high regards of respect for the provider. So you don't have to really do anything extra. At the end of the day, you just extend respect towards your patient and they will respect
Right,
you the same.
right, right.
Hmm. Well, we are almost towards the end of our interview. This is so good. I do not want it to end. So that means we have to invite you to come back and we can continue the conversation on other aspects of men's health. But for now, I would like for you to complete this statement that I ask most of my guests. If I only knew then what I know now, I would blank as a provider. And you could start as a certified men's health educator. So, however, you would like to finish that statement.
So if I knew what I back in the day, what know now, I think the big thing for me is understanding the role of social determinants of health, which are
Mhm.
extremely crucial. I think that's a conversation that's fairly new to the healthcare arena, but understanding those social determinants of health is extremely important. Important. Recognizing how factors like economic status, education, and environment affect men's health overall is vital in providing holistic health promotion to them.
Thank you. Well said. I can't top that. And so I want to thank you again, Dr. Gallegos, for joining us and giving us so much insights on how to approach one population, which is our Hispanic population. We have so many other populations that we would like to address, and we can always do that at another time for those who are tuning in. Also, feel free to reach out to Dr. Gallegos on LinkedIn, as well as NP Student, either or, for us to address any additional questions that you may have. We're hoping that you found this information very enlightening. I know I did. And if you did, share it with another colleague or an aspiring NP. Again, thank you for joining us here at Let's Talk with NP Student, and we will see you next time.
Thank you.
Thank you.